Today, I'm delighted to be joined by Edward Mapley, lecturer in dental technology at Cardiff Metropolitan University, in the next of our series of speaker interviews in the run-up to the Dental Technology Showcase taking place on the 12th and 13th of May at the NEC in Birmingham. At this year's GTS, Edward will be speaking about dental devices for those experiencing homelessness in the Dentech Forum on Saturday, the 13th of May at 10 o'clock. Thank you for joining us today, Edward.
Thanks for inviting me.
No problem. So you're interested in improving access to dental devices for vulnerable groups, and this will be the topic of your lecture at DTS this year. So what are the main barriers these groups face in accessing dental devices, and how do you think we can work to overcome these?
Well, it is a complex problem, of course, but if I was to kind of summarize it into a few areas, the first one would be, well, for vulnerable groups, and taking the homeless particularly, they tend to be quite transient. Obviously, dental practices are a location, and if you're moving around, then it becomes difficult to access those. You might not have access to public transport. Often the homeless have higher levels of dental anxiety as well, or they don't have the support. Perhaps they've experienced abuse in the past that might, be triggered by a dental treatment. So there's all kinds of additional things that we need to take into consideration when we are treating this particular group. And not only does homelessness include like street sleeping, it could be, the hidden homeless, those who are sofa surfing, which again is causing them to move around and not have easy access or any consistency in their lives. And as for the second part of your question, how can you work to overcome these? Uh, I mean, again, it's complex. There's a few ways. The first one, I think, is sort of interdisciplinary working. The idea that social services and health services like dentistry are quite closely integrated. And this is starting to manifest in things such as health hubs, the idea of making any contact count, and managed clinical networks, things like that, where professionals are talking together a lot more to make sure that we don't miss these patients for dental professionals and members of the public so that they can navigate the systems that we put in place. Yeah.
Brilliant. And what do you hope that delegates will take away from your speaking session?
Again, a broader understanding of what the problems are, and better minds than mine are working to solve these things. So what's out there right now, what could appear in the future, just essentially a way for us to move forwards and again capture these groups that we're perhaps missing or not serving as well as we can.
And you also work with the dental charity Dentech, which
Mhm.
aims to provide affordable dental appliances to those in need. Can you tell us about some of the projects that you've been involved in recently?
Well, for me, it's all about this IMTAS project, which is essentially a digital solution for trying to, I guess, as I was saying, trying to catch people who perhaps, so community dental services or other services are perhaps missing, by allowing charities to kind of refer directly into those. It then notifies our volunteer dentists in that area that there is a patient who requires treatment. They're then able to see that patient, um, deal with the dental issue that's occurring in that case, and then signpost them back into normal care, NHS care, or community dental services, or whatever happens to exist in that area. And that is my focus. But I know Dentech is off doing all kinds of things. I know the trustees Andrew Johnson and Andrew Sinclair have been off jet setting around the world to both Uganda to open. I know Andrew has opened a new dental laboratory there last year, and Andrew's been doing a lot of teaching in Cambodia. So very, very busy.
Yeah, brilliant stuff. And then finally, my last question is, apart from your own speaking session, what else are you looking forward to about attending DTS this year?
I mean, I really love just wandering across the floor and bumping into people that I haven't seen for years, or other students I've taught, or ex-colleagues I've worked with, peers. I love that kind of surprise of seeing somebody again. Mm.
Brilliant. Well, Edward, thank you so much for your time today. It's been a pleasure talking to you, and I look forward to seeing you at this year's Dental Technology Showcase.
Likewise.